ladies, and welcome back to my channel. My name is Aisha, aka Nurse Aisha. I'm a registered nurse here to spread awareness on preventative health and lifestyle choices for women. That is my focus, so you can lead a healthier and more informed life. Welcome back to this channel. Now, for those of you that are not yet subscribed, please make sure that you subscribe and comment and also like this video so I get to create more content for you. All right, so today's topic is alcoholism. So today I have invited Dr. Fossy Umazi, who's going to join us on this empty chair, and we're going to talk about the dangers of overconsumption of alcohol. So basically we're going to talk about alcoholism, or more alcohol overconsumption, and the risk factors that come with alcohol overconsumption, the dangers of the diseases that you as a person that overconsumes alcohol, how it affects you from a health perspective, but also how it affects our relationships, how it affects the family, how it affects the children that are around people that drink a little bit too much alcohol. So if that is the type of content that you would like to see, please stay tuned and welcome Dr. Fossy Umazi. All right, Dr. Fossy, welcome to my channel.
Thank you.
Thank you so much for agreeing to this meeting.
Yeah, exciting. Yeah.
It is? Mm-hmm. Okay. All right. So we're here today to talk about a sensitive topic.
Mm-hmm.
We're here to talk about something that is very important that we talk about, especially in our communities.
Definitely.
Yes. So first, please introduce yourself.
Yeah, my name is Fossy Umazi, or Sharon also. And I'm a resident in psychiatry. So when I grow up, I'm going to be a psychiatrist. Yeah.
That's amazing.
Yeah.
I have wonderful friends, y'all. I'm smart friends.
Yes.
Just pull up someone, call someone. Can you come here? Let's talk about this.
Yeah, amazing.
And this time it's your turn.
Yeah. Thanks so much for having me. Yeah.
I'm so happy to have you here.
Yeah, me too.
Okay. So initially, I wanted to have this conversation right before Christmas time, because we all know during Christmas time, there's a lot of alcohol consumption. But that didn't happen because, you are a busy woman.
Yeah.
But now here we are.
Yeah.
We're going to talk about the problem in our society with alcohol.
Yeah.
So you meet these people. You see these people as patients with alcohol abuse.
Yeah. I think we all see them. I think someone knows someone maybe who drinks too much, who's had a problem with alcohol before. So it's not only in healthcare we see them. It's a problem everywhere. Yeah.
It's a problem.
Widespread.
Problem.
Yeah.
Okay, so explain to us alcoholism as a disease.
Yeah, alcoholism is a disease. I know a lot of us think of alcohol as something fun. People choose to take alcohol, so how can it be a disease? But it is a disease, and there's a lot tied to it. It can be genetic. I mean, studies have shown that parents who drink a lot or who are alcoholics have children who also become alcoholics. So there's a lot tied to genetics also, and there's so many factors that affect alcoholism. Early exposure, also other diagnoses like ADHD, depression, lack of sleep. A lot of people, I can't sleep. I usually sleep better with a glass of wine.
Yeah.
It's
so
many factors, but it is addiction is a disease. So that's how we look at it, as a disease. Yeah.
Right. So because alcohol consumption in our society is very much accepted, there is a normal consumption. We have recommendations that allow us to have this much alcohol.
Right.
And when you exceed that, that becomes a problem.
Right.
Now, what we could do is maybe put up...
Right. It becomes a problem when you yourself feel like you need it. Like I said, oh, I can't go to sleep without a glass of wine. Or you wake up in the morning and it's the first thing you want to do. And then as a normal working class person, where it starts to affect your job, where you can't carry out your daily activities, you can't be productive at your job, you can't meet expectations. As a parent, maybe you get neglectful, or one time you hop into the car and you're like, oh, okay, I've just drank 1-2 glasses of wine, so it's not a big deal. I still have control. So when you start pushing these boundaries and your daily life is not working anymore, I think that's when we start coming into the problem of alcoholism. Yeah. And then we also need to talk about like, okay, maybe I drink 1 bottle of wine a week, but it's not a problem. I don't get drunk. A lot of people don't realize you build a tolerance.
Yes.
So before, this 1 bottle of wine used to get you a bit tipsy, but now it doesn't because you have a tolerance. So maybe you increase it to 1.5 bottles or 2 to get the same feeling you had before. Yeah.
And that's interesting that you say that, because I recently watched Martha Stewart. Everybody knows who Martha Stewart is. She has a new Netflix show where she talks about her life. And she talked about her father. And I remember it got to me when she explained that, why alcohol is so accepted in our society. And I quote, she says that he never looks or behaves like a drunk. He's stumbling or falls or shouting. Like,
exactly.
We normalize that. As long as you're not shouting, you're not stumbling.
You look good. You have an income. I mean, you don't look like an alcoholic, because, I mean, it's normal. We draw associations as people. Okay, so in my head, you would think, okay, an alcoholic, dirty, doesn't have a job, maybe on the streets. But I think it's not like that. It can be anyone.
What I usually say is the functioning alcoholics.
Exactly, functioning alcoholics.
Because you can still go on with your daily life. You still hold up a family. And everything, but you're still heavily drinking. Exactly.
And then we have another group that people don't really talk about. It's like binge drinking, where you're sober Monday to Friday. And then, Friday night, the weekend, gigantic amounts of alcohol. That's also a problem. It also counts as alcoholism, even though you're sober these 5 days. And your life is functioning.
I think there's a lot of people that do that justify drinking.
It's only on the weekends.
I had a heavy week. I've worked so hard.
Exactly.
I deserve this.
And this binge drinking, it's even more dangerous than the continuous drinking that people do. So I think
there's the binge drinking, there's the functioning alcoholics. They don't stumble when they're keeping their jobs.
Exactly. No one cares really. We normalize it.
So for me, with alcoholism, I mean, our communities. You're from Kenya.
I'm from Kenya.
I'm from Uganda. And I believe I've read so many studies. I mean, don't come from me. This is the truth. You have a high level of consumption in our country.
I mean, like, you guys come for us if you will, but let's just put facts on facts on facts. I mean, we know how it is. It's a problem.
And the thing is, the way we accept it, because you talked about the binge drinking. It's the party after party.
Exactly.
Constantly. And then there's this thing where, afterwards. It's a very...
I know.
Doesn't matter if it's a Monday. It's a Sunday.
I mean, even at children's parties, guys, let's not pretend. You go to a kid's birthday party, but the party's there, we cut the cake, but the rest of the night, the adults are drinking. I mean, myself growing up, I've been at these parties,
Yes.
So
it's a problem.
We have a problem,
So when we come back then and talk about the society that we live in here. So we're in Sweden right now, both of us. And the alcohol consumption here. I mean, there's a regulation.
There's a regulation.
Yes. Do you think that helps?
To
With
be
the
honest.
government controlling? Because in Sweden, only the government shop is supposed to sell alcohol beverages.
People say it helps. So
I guess it's helped so many years, but would that type of setting help in Kenya per se?
I mean, like myself, when I moved here, I was like outraged. I'm not an alcoholic. I'm not even a heavy drinker, but I was like, how is the state controlling my when I can buy alcohol? So I don't think this kind of setup would ever work anywhere else in the world.
But I think it would, because I lived in London for a short period of time. And I remember these off-license shops that were open 24/7.
Exactly,
How is that helping?
I mean, like,
Doesn't.
at the same time, people in Kenya are cooking alcohol in the villages, illicit brews.
Well, that's something else.
Yeah, but I don't know. Maybe it would, but
even though it's regulated, we still have a high
exactly
in this country, and it's a problem. And usually around the holidays, because I think when you talked about the binge drinking, a lot of Swedish people, Swedish citizens living in Sweden, there's a lot of binge drinking, which is accepted.
It is accepted. Midsummer, Christmas.
When is it? We have the holiday coming up.
Kräftskiva also, like
the welcoming the summer.
Valborg. Yeah, that's one. As I understand, that's one of the most dangerous holidays in Sweden.
Because
in
that's
terms of
usually
like
the first weekend or the first time a lot of young adults taste alcohol or try alcohol.
Yeah. So
that's a problem. I mean, I've seen this, I've been part of this generation. But I mean, with the regulation, there is, of course, there's breaking the law. There's other people.
Definitely.
You have to be 20.
I have to agree that in Sweden, the regulations help in terms of the youth. I mean, and drunk driving. So I love the regulations here. With the drunk driving, people, I've sat down at dinner with people and they're like, no. I can't take a drop of alcohol because I brought the car. So in that way, there's that kind of social responsibility. At the same time, I've heard people in Kenya say, I drive so well when I'm high. I mean, we've all heard it, but at the same time, it's not the truth. So the level of regulation here definitely helps.
So let's talk more about the actual problem, alcoholism, because I think we've mainly talked about the overconsumption. But when it becomes a problem, when it becomes a disease, and you need, so what we need to talk about is when it becomes a disease and you're trying to quit.
Right.
Maybe by yourself, and this is not working.
Yeah. I mean, alcohol is addictive. I mean, it's going to be hard to break the addiction. It has everything to do with dopamine and the neurotransmitters in the brain. So you can have a situation where the person wants to quit alcohol. I mean, most people know that this is ruining my life, but they just can't leave it alone, And that's just how it is with addiction.
The dangers of withdrawal, because that's usually what leads them to going back.
Exactly. So you decide, okay, I'm done with it. Okay, what happens? People get cold sweats, palpitations, anxiety. It's a bit like a hangover,
in itself.
It's like a hangover, a severe hangover in itself. And there's a lot of like myths. Okay, if you're hungover, just take a little bit of more alcohol and you'll stabilize. So a lot of people, withdrawal is like a really bad hangover, right? And the consequences of this, you can get abstinence, where you get withdrawal, which gives you heart palpitations, you get nausea, and people get nervous and anxiety. So that in itself makes you think, okay, maybe I can just take one more drink. But there is medicines that can help you through this.
Because usually people don't see alcohol overconsumption as a
disease,
dysfunctional situation, condition.
Exactly.
And they think, I can just quit when I want.
Exactly. I mean, if you've been drinking alcohol for prolonged periods of time, large volumes, the body's physiology is also used to this, so you can't just stop immediately. And a lot of people think they can, but there is help. And
so what is the first line?
What is the first line? I think you should contact your doctor and just be like, hey, I'm trying to quit alcohol.
And talk about it.
And talk about it. Yeah.
Be very specific and correct on exactly the amount that you're having.
Exactly. Because I feel like people maybe minimize the amount of alcohol they're having. So to be honest, if you're coming out and you need help, honesty is the first step. And a lot of healthcare professionals, they don't judge you.
No.
They just want to know so that they can help you through it.
So there's the medical assistance.
Exactly, there's a medical assistance. And then there's also so many organizations here in Sweden that can help with rehabilitation and treatment.
And then you guys.
Yeah.
What you are aspiring to.
Right. Psychiatrist, sorry. Right. But we know alcoholism, it has many friends. Yeah. Depression and anxiety, alcoholism. They are friends. Insomnia and alcoholism, they're also friends. ADHD and alcoholism, they're also friends. I mean...
So how do you help? How do you assist?
To be honest...
struggling with that.
You know, alcoholism can be a consequence of depression, but you can't treat depression without treating the alcoholism. It doesn't matter how many pills you take, how much counseling you go to.
Yeah.
As long as your problem with alcohol is there, it's not going to help you. So in psychiatry, they usually recommend contact with beroende, like the people who help with addiction, just to get rid of that addiction. And then when the addiction is gone, then we can come back and help you with your depression or the ADHD or anything else.
So it has to be holistic kind of.
Basically, it has to be holistic. But in this case, if you have ADHD and you're trying to have medication for your ADHD, in this case, you'd have to deal with the most acute problem, which is the alcoholism.
Yeah.
Once that is under control, then you can tackle the problems with the ADHD. And the same thing with depression. I mean...
Because the way that you explained it. So you talked about the depression and anxiety being friends and ADHD.
Yeah.
So, but my experience...
Let's not also forget, now I'm just talking from a psychiatric perspective, but a lot of problems also, obesity and being overweight, high blood pressure, liver kidney issues, diabetes, alcohol is also...
Because of alcohol consumption. Okay.
Right, yeah.
All right, so because... from my experience, what I've seen is that people start drinking because of these conditions, because they are depressed, because they have anxiety, or they have relationship issues. Yeah. So now they're numbing the pain with the bottle. Yeah. And then it becomes a problem. Yeah. So what's your experience when you meet this?
Like, for example, anxiety, right? You take a little bit of alcohol, it feels better after a little bit, but it comes back and it's worse.
Some people have done it because of shyness. That is something that we've seen, we've experienced in this society.
What is it? Liquid courage. Yeah, we've experienced. Oh my gosh,
a lot of shy
people. You know.
Feel like they can fly with alcohol, and then it becomes a problem.
Exactly.
So,
It gives you this courage that you never had before.
Okay, so what kind of tool would you give people to do instead?
You know what? I feel like adults, can we work on ourselves as well? If you feel like you're shy and you want something, how can I make myself better at this? If I want to be better at drawing, I'd be like, okay, how can I be better at drawing? And do the work.
So choose something else,
Or just put in the work to give yourself confidence or to challenge yourself, get out of your shell, like therapy, anything.
But before that, because there are some younger people, most people start maybe at a younger age, and then it becomes a problem. So from my experience is that when you start drinking, it's not considered a problem.
No.
But when it becomes a problem, then it's really hard to accept.
Right. Yeah.
What is your experience?
I mean, there's a lot of stigma around it as well. It's not just, and then also it's like, I don't want to be associated with this image that people have of an alcoholic.
So that is something that is talked about a lot in recovery, like alcohol recovery programs, and how the person with addiction has to come to the realization and acceptance that this is a problem.
I mean,
and fix it.
Yeah, you can. I can force a patient to take the tablets as much as I want, but if they don't want to stop drinking, there's no point. What are we doing?
I believe that a lot of people actually want to stop when they see that this is causing problems.
They do.
But then, the actual taking the steps.
And it's difficult. I think it is difficult. It is. I mean, like, even for myself, when I'm like, okay, I'm not going to use my phone for like 3 hours, I'm like, it's also a type of addiction. I'm not comparing it to alcoholism, but it's difficult. It's it's a problem. So also maybe the fact that it's so difficult makes you not want to. Makes it easy to quit. Like, because okay, it's too hard. I don't want to do this. Yeah.
All right. So when alcoholism becomes a problem, it affects not just person drinking affects a lot of people around. What's your experience?
I mean, I think about the children. I mean, these children watch, if it's in the household setting where one of the parents or guardians drink a lot, then these children see a lot. They see this behavior. What happens, and then they have to take on the role as the person who takes care of the parent. And
if it's that severe.
And I think it's also, these children also get introduced to alcohol early, which is also another risk factor in terms of addiction. They get an early introduction to alcohol.
Exposure.
Yeah, exactly, exposure. So I think that's one of the consequences. And then, I mean, also in society as a whole, drunk driving. I mean, how many lives are lost to drunk driving? I know people only think, oh, it's the driver who dies. No, not only the driver dies. It's also just sometimes the innocent bystanders. Sometimes they survive. But how about the people they killed, So it is...
I want to focus more on the family.
On the family,
how it affects.
Right.
So many years ago, I read this book where it's a Swedish book in Swedish by a Swedish author, and she talked about the family, relatives. I think the book is called Relatives, and it's very much about the concept of or the problem around alcoholism in the family and the people and how it affects, because it doesn't affect everyone in the family. Depending on if you're a single person, or if you're a father or mother. And it was very interesting. She also brought up a very, very, very sensitive part where they talked about being co-addictive.
Right.
Someone not being addicted, but you're co-addicted because you're trying to protect your spouse or your father. Or mother.
Exactly.
Do you have any experience in that?
I mean, we see it where it's like, right, he's a really nice guy. I'm bringing him here. We get like people's partners making their appointments. But yeah, go ahead, make the appointment, but you can't bring the person, you can't force the person there. So, or no, give me the medicine. I can make him take him or her take the medicine. So it's, I understand they want what's best for their partner in that way. So
there's some people that go to the extent of even helping the person hide.
Exactly. Right.
So
like
that it doesn't affect the work or something.
exactly. It doesn't, okay, nobody can know because you're a prominent member of society. So it's really important that, it happens.
Shameful.
Yeah, it's shameful. Yeah.
So we're gonna go deeper into the conversation because I myself have been affected by alcoholism. Not personally. I don't think that I've been an alcoholic.
I get it. We get it. Yeah.
Yeah. So my situation goes far before my generation. So my grandfather was addicted to alcohol. And then from what I can see, this is following in the generations. And I guess the reason that I read the book that I just told you about, the Swedish book, is because I have been the relative. I am the relative. And the psychological pressure it puts on you as a relative when it gets, because for me personally, I've seen my relative from the beginning. Starting with, the party. Having fun. Then heading to
escalation.
So I kind of have navigated through almost all the stages. And I cannot imagine the people closest to my relative, because I've not been, I'm a sibling. So it's kind of a little bit far, because as we get older, then the immediate family, they get wives and kids. So when you meet these families, how do you get to have the whole family and talk about this?
To be honest, I haven't had so much contact with families. And in Sweden, I know the commune has a big part in rehabilitation, where they contact the families and give them any type of help or support they may need. So to be honest, I don't have so much experience dealing with families.
I actually did attend this family meeting with a bunch of women, and we studied in a group, and a lot of them were mothers to children that were using alcohol. And
I also have a friend who her ex-partner is an alcoholic, and she was telling me she can get these phone calls maybe 2 times a month where her ex is picked up by the police and he's in jail or he's somewhere helping with the detox. And they're like, where's the child? Do you guys need help? Is this okay? And where she has to tell the police, no, it's fine. The child is with me.
Of the system and how they regulate that. Because as soon as they find out that you have minors, then they have to.
So she says at least two times a month she has to be like, no, the child is with me. Right now they're not in good. He's in his drinking phase, as she says. So he doesn't really have contact with the child right now. So
I know that situation where you have to go back, because the funny thing about alcoholism is that it does go in phases. Sometimes they maybe come to a realization where they kind of put down the bottle for a while.
So it's interesting. Also, she said he's in his drinking phase now.
The phase, and then he phase out. Because for us, me and my relative, it's come to kind of like a finish line. But the problem with it for me is the constant fear. The constant fear of going back to where we've come from. Because we're in a phase right now because of the problem with the law. My relative had to quit. Basically by force, quit the habit. But then from experience, I know that there's a falling off the wagon phase. And that is a constant fear of mine.
But you have to remember, I mean, addiction is a sickness, and it's a lifelong sickness. It's like high blood pressure. You get it and you've got it. So you have to...
Hypertension is not something, that affects probably the whole family, but
alcoholism does. But I think we should also treat it like any other disease, addiction, like any other disease, in that way that it's not going to disappear. And so this person is going to need probably lifelong treatment and support if they're going to remain sober.
So going back to our community, what type of help do they have in Kenya, for instance? Can people actually walk in and knock and ask for help?
Kenya is special because those who have it, those who don't. So I think...
so it's a class?
I think those who have the resources can get the help, but it's actually gotten better now. So I think there is help. There is help to get. Once you go to your doctor and say, I'm addicted, that you can get the help. If you decide to come to that realization, there is help. There is help. And I feel like Kenyan society has gotten so much better in terms of mental illnesses, and even talking about like alcoholism. I mean, like these new young people there, oh my God, amazing.
They are
changing things, even when there was civil unrest in Kenya, and they were like, Gen Z are very special. They have no tribe, they have no classism, they have no tribalism, they have no classism. They are just Kenyans. They want justice. They want change. And I think that's where...
Now we went all political.
We went there. But I think generally they are like that. They're open. They talk about feelings. They talk about problems. And I think it's just positive. And they don't have this... they don't judge. I feel like they're open in another type of way.
But I did hear about a situation during the COVID pandemic. Where there was a issue with alcohol consumption because people didn't have a lot to do.
And it was being delivered. I mean, some things you just have to allow Kenyans to be Kenyans. They can't happen anywhere else in the world. Sometimes I read some things that happen in Kenya and I laugh. I'm like, we're unique. So that one, let's not even dive into that one.
All right, so... Coming back to alcoholism being a disease. So this is a problem that you're probably going to see more and more of your patients struggle with in connection to other issues and conditions.
What's interesting? I heard like this Gen Z generation, alcohol is not that interesting to them. Number one, it's because they don't have the money. Inflation and all that. It's expensive.
Hopefully it's because they have other things to do.
No.
It's not that
drugs.
Expensive.
So that's another issue. Another type of stimulation. But it's not that interesting to the young generations.
But I still feel that it's being introduced to them as well, because there's a lot. When it comes to alcohol, I feel like we glamorize it.
Definitely.
We glamorize, the nice bottles, the tastings of
status,
wines
like how much it costs, where's it from? But are you not sophisticated enough? You couldn't taste the pear in that wine? I mean, like, it tastes like grapes. Okay. Me too. I remember I was at a wine tasting. And the lady was like, she was going around the table being like, what do you taste? And I was like, it tastes like metal. But I couldn't come up with something to say. And I said metal. And she just gave me the dirtiest look. And I was like, I should have lied. Because if you say pear, then you're always there.
I guess I don't have those taste bugs.
Yeah.
to taste those different.
But I don't get it. I guess we're not that sophisticated.
No, so I guess the Gen Zs maybe get into that as well.
Maybe, because it's like a status symbol once you get to a certain age. You're like, oh, I got this wine. I don't know.
They need to realize, that this could turn into a problem, even though it's...
To be honest, I don't think drinking wine or alcohol is a bad thing, but I think there needs a level of self-control and discipline when you're handling it. Yeah. So, I mean, like if you drink wine on the weekends or you go out and have some cocktails, it's not a bad thing, but I think you should...
As long as you're to that level.
Yeah, self-discipline and a little bit of restriction because it is harmful. Yeah.
So what I did want to talk to you about is I think we touched a little bit on that with using alcohol as an escapism and trying to numb whatever pain that you're going through. Especially if you have some type of trauma. You feel that will help you. But we have to emphasize that is not the solution.
It's not the solution. I mean, no, it's not the solution. You have to do the hard work. You have to face your demons, and you have to do the hard work. But alcohol is not the solution. It's absolutely not the solution.
That is perfect. I believe that is the perfect way to end this conversation. Go to therapy. Basically.
Yeah, go to therapy.
Do something.
And I mean, like, you don't have to have a private therapist. Go to church, go to the mosque, talk to your elders. I mean, therapy looks different for different type of people. Go to a therapist. I mean, there's help. Yeah.
And then I think what we need to also talk about is not leaving people that have an addiction alone.
No.
Try to help, but from my experience, you try to help, but remember not to lose yourself while helping.
Exactly. Yeah.
I think that is something that I would love to tell people, that this is, you can actually get into trouble while helping.
I mean, we should all have compassion. But you have to take care of yourself, not at your own expense. Definitely not.
Because that person needs to come to their own realization.
Leave it to the professionals. Try
to send them to the professionals.
Send them to the right place.
All right, I guess we'll end it there.
Right.
Thank you so much, Dr. Fossy, for joining us.
Thank you for having me.
And I hope you come back and we can talk about something else.
This was fun.
So fun. All right.
But thank you so much for having me.
You're welcome.
All right.
Thank you everyone for watching. I hope that you tune in for another episode of Nurse Aisha. Don't forget to subscribe, like, and comment on this video. If you have any questions regarding alcoholism or alcohol overconsumption, please let us know in the comment section and we will try to answer them.
Right.
Thank you.
Thank you.
Bye.
Bye.